Hello everybody, good evening. Welcome to Nurse Untitled channel. Today we will speak about basic life support. What is basic life support? What is the component of basic life support? At first, we need to know, we will speak about adult basic life support. At first, when you found patient arrested or there is no response from patient at the time of accident or you are in the hospital, the first thing you will ensure safety. You will ensure your safety and the patient's safety. For example, if besides the patient, if you are outside, there is besides the patient fire or accident, something like this. So you must ensure you are safe. You are safe because you are the one who will provide the service for the patient or for the person who is have no response. So you will ensure your safety and the patient safety at first. Then you will check response of the person. So you will check here, hey, hello, how are you? You hear me? He will respond or not respond. If not respond, you will call for help. Call anyone beside you, or when you are in the hospital, you will do code blue. So the third thing is call for help or activate code when you are in the hospital. The third thing is check the patient pulse by cab. Okay. C for circulation. You will check the pulse first because most common cause for cardiac arrest in adult is the heart. So you will check first the pulse. How you will check the pulse? By carotid pulse. You will put your index and middle finger here beside the trachea by 2 cm. So you will put your fingers here to check the pulse, if there is pulse or no. Okay. The second thing is airway. You will check the patient airway. Okay. So airway, we have two methods to open the airway for the patient. Head tilted, chin left. The first one. This one method, you will put your first hand on the head of the patient and the another one in the cheek of the patient, in the head of the patient. So you will do like this. So you will open the airway of the patient to check if there is any obstruction or no. The second thing, this is especially used during spinal cord injury, spinal injury. So if you suspect the patient have spinal injury, so don't use head tilted chin left. You will use jaw thrust. You will put your fingers here and open the airway like this. Okay, so you will open like this, open the airway. When you put your fingers here, the jaw, it will push up, so the mouth will open. So you will use here when you open airway, head tilted chin left or jaw thrust. Okay. The third thing is breathing. You will check breathing for the patient by look, listen, feel. You will put your head in front of the patient's chest. So you will look to chest rising, if there is any chest rising or no. Okay. Listen to the sound of breathing, if the patient have sound in breathing or no. The last thing is feel. You will feel the vapor which come from the mouth of the person or from the victim. So look, listen, feel. This process will not take more than 10 seconds. Must take not more than 10 seconds because here time is life. So you must here keep this process, all of this process less than 10 seconds. Okay. So when you check pulse, if you found the patient have pulse but no breathing, at this time you will give the patient one breath every 5 to 6 seconds. One breath every 5 to 6 seconds, and then it checks pulse again every 2 minutes. Check pulse again every 2 minutes. Okay. So if we found no pulse and no breathing, so we will start CPR. CPR by rate 30 compression to breathing. How to do compression? You will put your palm of the hand here on the chest and lower part of the chest at left side, and then interlock your another hand like this on the chest of the patient like this. Okay. So you will extend your hand or your arm like this. So you will push from here, from your shoulder, not from your elbow. Okay. So you will extend your hand like this and push in hard and fast on the chest of the patient. Okay. So here the rate is 30 compression to breathe. Okay. After 2 minutes from this one, or after 5 cycles, you will check after 2 minutes the pulse, if there is pulse or no. If there is pulse for the patient, you will put the patient for recovery position after the patient gain his pulse again. So you will put patient in recovery position. What is recovery position? At this time you will put the patient on his side. The patient at when CPR, he is lying flat on hard surface. So here the patient gain pulse, so you will put patient in his side, right or left. For example, you would put the patient on his left side. Then you will flex his knee of the right leg. Okay, not to let the patient to come back again to his back. Then at this time, the patient, if he has any saliva or any hemorrhage or bleeding in his mouth, so it will be drained outside. So you will patient in recovery position. What if you found no pulse? You will continue CPR again, another cycle CPR, another 5 cycle for CPR or for 2 minutes, and check the pulse again. Okay, here when you are outside, now there is something available like AED, automated external defibrillator. This is available now in hotel, in gym, in clubs like this. So if you found this one, the second rescuer, the one who come for you, he will use this one. He will attach AED to the patient. How to attach this one? First, you will open the AED. Then the AED will give you instruction. You will follow his instruction or the instructions of AED. He will say to you, attach the pads, then clear to check the rhythm of the patient. Then if he will give shock for the patient or no, then he will say to you, continue CPR like this. So if the patient not shockable or the rhythm not shockable for the patient, so the AED will say to you, continue CPR for 2 minutes and then check pulse again after 2 minutes. Okay. But if the rhythm is shockable, so he will give shock, the AED will give shock to the patient. Then he will tell you, continue CPR, don't stop CPR, don't stop CPR. Okay, continue CPR again for 2 minutes, then check pulse again after 2 minutes. Okay. Here, chest compression rate, we will do at 1 minute from 100 to 120 compression per minute, 100 to 120 compression per minute. The depth of compression is from 5 cm to 6 cm or to 2.4 inch. Okay, so you will decrease the chest of the patient from 5 to 6 cm. Okay, we will give the patient 2 breaths, every breath or each breath in 1 second, each breath in 1 second. Okay. We will abbreviate all of this in small abbreviation. This small abbreviation, doctor's cab. D for danger. At first, you will ensure your safety and the patient's safety. The second thing is response, the patient response. After that, S, this is shout for help. You call for help or call ambulance to come to you. Okay. After that, C, circulation. You will check the pulse of the patient. Okay. A, this is airway. You will check the airway is in obstruction or no by the two-way. Head tilt, chin lift, or just thrust. Okay. B, bracing. You will use lock, listen, feel. Okay. D, defibrillator if available, AED. Okay. Now we finish our video today. Thank you for watching. If you feel this one is good, please don't forget to do subscribe and share. Thank you.